Welcome to the Health Update. I'm Madison Kasper. Here with me is Dr. Aarti Raj, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is the use of artificial intelligence in the healthcare system. Dr. Raja, what is artificial intelligence?
So artificial intelligence, or AI, is basically technology that allows computers to simulate human intelligence and utilize it for problem solving capabilities.
How is AI being used in the healthcare system?
AI is already currently used in the healthcare system in several ways. So simple things like the way we make our appointments. So if you're making an online appointment with your healthcare provider, if you are getting those reminder text messages or phone calls that remind you that you have an appointment, or a new parent getting reminded that their child has a vaccination coming up, or maintenance of electronic medical records by hospitals or by physicians' clinics, all these are using some kind of artificial intelligence or AI technology.
How can AI assist doctors in detecting early signs of diseases?
So the idea behind using AI for disease detection is thinking about, can we utilize computers to recognize certain patterns or risk for a particular disease condition? Can we develop diagnostic tools where the diagnostic tool can recognize patterns in a patient and indicate or catch a disease condition earlier than one would if they just waited to get a particular symptom before they showed up at the doctor's office?
What are some potential challenges in incorporating AI in patient care?
Absolutely. So there are a lot of challenges right now, and they can be a variety of things. One is just simply trying to figure out, how do we keep all this electronic data that we're collecting safe? How do we protect patient information? How do we ensure that the data is accessed by the right people? And then, of course, how do you make it affordable? How do you make it equitable so that everybody has access to this or the ability to use this kind of technology? And then, of course, there are hurdles with the laws, like what is okay to collect, what is not okay. And we're still kind of navigating those parameters, which is what which are some of the biggest challenges right now, and we're navigating through those at this moment in time.
How does this affect college students?
So AI is going to be a part of almost every field in the future. So that is something college students have to start thinking about. And of course, as college students, when you are studying and you're writing papers, you're writing or learning new information, there is AI involved there, and kind of navigating through that as well, and figuring out what is okay to utilize with computer technology, what is not okay to utilize. That landscape is also changing. So a lot of things for college students to think about, pluses and minuses.
How has AI affected higher education?
We often think of, students are using AI to, the first thing that pops up in most people's mind in higher education is, ChatGPT. That is a type of generative AI. And the question becomes, are students just utilizing this platform to input some data and have AI write or do their work for them? That is one part of it, and higher education, universities, NSU included, is constantly thinking about how to work with that, and how do we evolve, how do we adapt to the presence of this technology. And as an educator, I would imagine this is not something that's just going to disappear. So one way to think about it is, how can we all adapt? How do we as teachers, how do we teach, how do we adapt our teaching styles knowing that AI exists out there? And as students, how do you adapt your learning styles and your writing styles, and how you grasp information knowing that AI also exists out there? And higher education and universities as a whole are trying to figure out what the best way to move forward with this is. So definitely, yes, it impacts higher education, but there are pluses to it too, and it's not all negative and bad.
Any last thoughts?
There is going to be AI, and the question just becomes how are we all going to learn to adapt and live with it? And that will involve, for example, higher education coming up with appropriate policies for what is okay to use, what is not okay to use. And very similarly, in the healthcare scenario, either governmental agencies or some overseeing agency has to come in and say, this is how AI is going to be used. And this will hopefully, putting these measures and guardrails in place will also help convince people that this is there and it is not all bad and there is some good to it, and we're going to harness the good and figure out how to utilize it in an appropriate manner.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.